With runners, you'll most likely be dealing with hip, leg, and feet issues of a chronic nature. One of the leading causes of running injuries is the mistake of adding mileage or increasing training too quickly. The following are injuries most encountered in running, but athletes participating in other sports will encounter some of the injuries covered here. We'll cover plantar fasciitis, shin splints, iliotibial band syndrome, and hamstring strain. Plantar fasciitis is an inflammation of the fascia that runs from the calcaneus to the base of the toes. It gives support to the arch of the foot on the plantar side. This inflammation can be caused by an increase in activity and also an increase in the impact of the sport. The symptoms include pain that runs from the heel to the medial side of the arch. The most intense pain can be felt in the morning when your athlete first steps out of bed onto the arch, and also when they're barefoot or they're wearing shoes that are not supportive for them. To treat plantar fasciitis, massage techniques will include longitudinal stripping from the base of the toe towards the calcaneus. I just want to get in there and strip out the fibers from the base of the metatarsals to the calcaneus. Now, this can be very painful for your athlete if you do it too hard, and it also can cause more inflammation when you're trying to help heal this space. So make sure that you communicate with your athlete and make sure that this isn't too painful a stroke for them. Then you can move on to some transverse or circular friction around the areas that are most painful, around the base of the metatarsals, all the way down to the calcaneus. Be careful around the calcaneus area. Sometimes your athlete will have a heel spur in this area, and that can cause further damage to the tissue. So just do it lightly around these areas and increase your pressure as you go up the medial arch. Another thing that you're going to want to do is release the tension in the calves and the soleus area. The calves and the soleus join together at the Achilles tendon, which is a continuing band of fascia that goes around the calcaneus and underneath to this plantar fascia. So you'll want to make this relaxed and as broadened as possible so that it releases that plantar fascia. From this position, you'll bend the client's knee and brace it. And then you'll go ahead and use nice broadening techniques along the gastrocs and the soleus area, pulling back, spreading the tissues. And when you find an area of tension, you'll go ahead and do circular friction around that area to release the tender points. Ice can be used in a couple of different ways to help benefit inflammation of the plantar fascia. One way is to take a flexible gel pack and wrap it in a towel to protect the athlete's skin and place it over the plantar side of the foot. You'll need to be careful of placing ice on the foot. Sometimes people have a decreased sensation in their feet, so they need to know when to take the ice off. I recommend about 10 minutes. So this is one way of applying ice to the area. So I would wrap a towel around this or an ACE bandage to hold this securely to the arch. You want it to form around the foot. Another way you can apply ice is with a frozen juice can, and you'll have the athlete put it on the floor and roll it up and down the arch of the foot. This provides a nice stretch to the fascia and it cools the tissue at the same time. After you work the muscles, you're going to want to stretch the fascia out. It's very beneficial to lengthen this area out. So what you'll do is you'll take a simple hand towel and fold the insides in. Demonstrate by having your client sit up. And they're going to wrap the towel underneath the ball of the foot. Now it's not down here at the heel. What you'll want to be doing is pulling the toes back and pulling the top of the foot back. So they'll hold the sides of the towel, and you'll instruct them to pull lightly until they feel a nice tug on the fascia, and hold for about 15 to 20 seconds. Is that comfortable for you? Good. And release. Point and flex your toe. Good, just to help release and flex. A little faster, point and flex. Good, and then you'll repeat the stretch for another 15 to 20 seconds, wrapping it around the ball of the foot. And a nice pull. Can you feel the fascia stretching out?
Yep.
Good, and release. So you want to have them do that at home 2 to 3 times a day. And now I'm going to show you a strengthening exercise for this area. To help strengthen the intrinsic muscles of the foot and lend support to that arch, we're going to have Justin go ahead and pick up items with his toes. You can use a sock or a marble or anything that you have. And what you'll do is you'll have the athlete place the object on the ground, and then you'll have them use their toes to pick up the object and transfer it to their hands. They'll go ahead and repeat this about 15 to 20 times, 2 to 3 times a day. Shin splints is a catch-all term for pain in the tibial area. It'll either be medially on the posterior tibialis or anteriorly on the anterior tibialis. You'll also address the soleus and the gastroc muscles. To work on shin splints, you'll want to address the medial side of the tibia. Oftentimes you'll find that this is where most of the pain occurs in runners. This is caused by pronation of the foot, also insupportive shoes, and running on hard surfaces. You want to start with compressing this area to bring blood to the tissue. And then progress to circular friction to break up any adhesions. This will be painful for your athletes, so make sure to check in with them from time to time. You'll finish this treatment with some effleurage. This effleurage is fairly deep. To work the anterior tibialis, start with compressions again, bringing blood to the area. Progress to circular friction, looking for adhesions, and broadening the tissues. Finish off your technique with some effleurage. Now we'll progress to the soleus and the gastroc. You'll have your athlete bend the knee. You'll need to address both the medial head of the gastroc and the lateral as well. Start with compressions, pulling towards the bone.
up the medial side of the gastroc and the soleus. And then progress to circular friction, looking for tension and nodular areas and places that are tender to the touch. Stop there and provide some focused attention. And progress to the lateral side. Direct compression. And this treatment with broadening techniques. Pulling outwards and spreading the tissue. And then you'll go ahead and progress to some stretching and strengthening exercises. An effective way to stretch the gastrocnemius muscle is to have your athlete face a wall and put their arms against it with one leg back. She'll want to press the heel into the floor and stretch the Achilles tendon by leaning forward and holding this position for 20 to 30 seconds. Now we'll progress to stretching the soleus muscle. You'll have the athlete stay in the same position. However, she'll slightly bend her knee towards the floor until she feels a tension on the lower 2/3 of the leg. Again, holding it for 20 to 30 seconds. You'll want to have your athlete repeat this 2 to 4 times. I'm going to show you how to treat iliotibial band syndrome. I've placed Justin in a side-lying posture. What you'll want to do is bolster them at the knee, and the underlying leg is straight behind it. And then you'll have them hug a pillow and support their head for comfort. Iliotibial band syndrome is caused by a tightening of the iliotibial tract. The iliotibial tract inserts into the tensor fascia lata on the anterior portion of the hip and also the gluteus maximus on the posterior. Release these muscles. This is what's causing the tension in the tract itself. And then later you want to go on and release the whole entire fascia and the band itself. Press into the tensor fascia lata and get some blood flow to this area. Now, if this is too painful for your client, you can go ahead and shorten that area by taking the knee and bringing it up into a shortened position. And then try again and see if that's less painful for your client. So you'll go ahead and move that knee around, push into that tensor fascia lata, spread the tissues out, warming and releasing tension. Move on to the gluteus area. Okay? Again, you're going to want to use some compression in that area, moving all the way down to the insertion.
And then you'll want to use some spreading techniques to broaden that tissue. And what I'm doing is pushing my hand into the area and then broadening outwards, all the way from the origin at the sacrum and moving along into the insertion of the iliotibial tract. Once you've released that tension, you want to expose the side of the leg and get some oil on your hands. Now, the main goal of this method is, again, spreading the fascia out. So I'll be doing a broadening type of effleurage, making sure you go all the way out to the insertions of the tensor fascia lata and the gluteus maximus. This technique helps release the fascial adherences in the skin. And the front, release and stretch. And then you want to go ahead and actually focus on the tract itself by doing some circular friction, either with your elbow, or you can go ahead and use your thumbs. Multi-directional friction helps break up adherences. And make sure to do this up at the top of the trochanter also. This can sometimes be painful to the recipient, but you're going to want to put pressure in these areas. They're very fibrous. And then go ahead and end with some nice broadening techniques again. Stretching can be very beneficial for the iliotibial band. Turn around and have them face the wall. And then you'll put the affected side behind the good leg. Stretch this area of the iliotibial band. Lean your body over to the unaffected side and stretch out. Go ahead and put your hand there and stretch out this area. Good, facing this way. Go ahead and stand a little taller on that knee. Good. And you should be feeling a stretch right in this area. Have them hold for about 20 to 30 seconds and repeat this 2 to 3 times. And this will help keep the tension down and the muscle around it pliable and elastic. Recent studies have shown that iliotibial band syndrome can also be caused by weak abduction muscles. So what you're going to want to do is strengthen those muscles and decrease the tension on that area. Face the wall, and then you will slightly bend the knee, and then bring the leg straight into abduction and then down, really concentrating on the gluteus medius muscle. So Justin, why don't you go ahead and slightly bend this knee. Okay, good. And you're going to raise and lower this leg straight out, And you're really going to want to feel tension right in this area. I can feel tension. Do this 15 to 20 times. Make sure that their back is nice and straight on this. Good. And have this repeated 2 to 3 times. A hamstring strain causes pain when the muscle is flexed at the knee. This is because scar tissue has formed in the area. So you want to focus your massage on lengthening the tissue. Start with some assessment of the area and warming of the fascia. Some nice spreading techniques. What you're doing is you're looking for, feeling for adhesions in the muscle tissue. Once you find an area of tension, you'll want to go ahead and put some pressure into that area. Justin, is this a little bit tender right here?
Yes, it is.
You'll go ahead and do some circular, multi-directional friction around this area to break up the scar tissue and make it more functional. And then go ahead and stretch that area out again. These spreading techniques. You're also going to want to examine the insertion area of your hamstring, which is up on the ischial tuberosity. A lot of times you'll find tension and tightness there. Go ahead and do some circular friction around that area. Is this a little tender and tight for you?
Yeah.
And then go ahead and get in there with some nice deep compressions to broaden that tendon out. You're also going to want to address the sides of the knees where the semitendinosus and the semimembranosus insert, and also on the outside where the biceps femoris insert. Give those tendons some nice attention with some circular friction. And then I always like to end with a little bit of elongating techniques. I'll grasp my hand to provide some tension around the knee, and then I'll go ahead and push the tissue up towards the ischial tuberosity. This is a nice lengthening, broadening stroke. Check back on those areas of tension that you felt and make sure they're loose and pliable. To help further decrease tension in the muscle, use an active stretch. Sometimes just picking up the leg and having passive stretch is too much on the hamstrings. Sometimes this can actually even cause further damage. Have them engage in this stretch. You'll take them underneath the gastroc and you'll go ahead and push them until you feel a slight tension. And then what I'm going to have you do, Justin, is go ahead and push down with about 20% of your muscle strength downwards onto my hand with just your hamstrings. Okay, so push down, right? And we're going to hold this for about 10 seconds. And release. Now what you're going to have them do is activate the antagonistic muscle by contracting the quadriceps and pulling the hamstring up. Justin, so what I want you to do is pull your hamstring up towards your chest as much as you can. Good, and hold. Once you feel tension, you'll have them hold that and actively go ahead and push down on me again, okay? Just about 20% of the muscle strength. Hold for 10 seconds. And release. And from this position, I'm going to have him engage the quadricep group again and pull upwards towards your chest as much as you can. Good, and hold. This helps release a lot of tension in the hamstring muscle and is very useful for hamstring strains. And relax.